Good morning. Thank you for being here. We are fast approaching summer, and we really wanted to come together to talk about the Pharmacare Act, which is C-64. As schools are wrapping up, people are getting their agenda done. We are here because the Senate has work to do. There's an affordability crisis. We need to get some cost savings to people as soon as possible, which is going to require Pharmacare passing and making sure that the drugs that people need, whether it's the diabetic category or in contraception, are afforded to Canadians as soon as possible. So we are here to talk about the urgency of that and to push so that the Senate will get this done before the summer rise. So we're here, our president, Bea Bruske from the Canadian Labour Congress, Jason Maclean, who is the chair at the Canadian Health Coalition, and Manuel, who is here from Heart and Stroke. So I will pass it over to Bea. Thank you.
We're here today to call on senators to quickly and without delay and without any amendments pass Bill C-64. It is incredibly important that we start getting prescription medications into the hands of people living right across this country. People are managing an affordability crisis. And for decades, the Labour movement has fought for universal single-payer pharmacare. This bill is a step in that direction. It's a very, very important first step on that road. The ability to have access and to be able to afford birth control, diabetes medication, as well as diabetes tools is critically important. We know that across Canada, 1 in 5 individuals do not have access to a prescription drug benefit plan. We know that a quarter of Canadians report that they actually skip doses or split their pills or don't bother filling their prescriptions because, quite frankly, they can't afford it. And that's shameful. That means they end up in hospital rooms and in emergency wards as well as doctors' offices. There is a better way. Passing this bill provides an opportunity to address these issues. We know that 3.7 million Canadians live with diabetes, and that 1 in 4 of those don't follow their treatment plans because they simply cannot afford to. We know that type 1 diabetes costs individuals up to $18,000 a year, type 2 up to $10,000 a year. Incredibly important also that we have access to birth control in this country. 9 million Canadians are of reproductive age. That's a quarter of our population. Those folks need to be able to access the items that they need. This is absolutely an affordability issue across Canada. We need this government to prioritize signing bilateral agreements with the provinces and territories to provide this kind of step in the right direction. This is only a first step in the long path to universal single payer, but quite frankly, it's this or nothing, and it's time to get this done.
Thank you. Heart and Stroke applauds the Government of Canada and Parliament for introducing Bill 64, which lays the groundwork for equal access to life-saving drugs for all. We're here today to encourage the Senate of Canada to quickly approve Bill C-64. People in Canada appreciate having a universal healthcare system, but Canada is the only country with Medicare that does not include prescription drugs as part of its universal healthcare program. The current patchwork of public and private drug plans in Canada has created fragmented drug access, leaving millions struggling to afford the prescription medications. While many people in Canada have some form of drug coverage, it is often not sufficient and poses affordability issues. In fact, we know from the Hoskins report that 7.5 million people in Canada either have no drug coverage or inadequate drug coverage. Also, a poll commissioned by Heart and Stroke and the Canadian Cancer Society found that over 1/4 of people in Canada had to make difficult choices to afford prescription drugs, such as cutting back on groceries and delaying paying rent, mortgage, or utility bills and incurring debt. As well, with the introduction of Bill C-64, the foundation is being led for the first phase of national universal pharmacare in Canada through single purchaser drug coverage of diabetes and contraceptive medications, providing equal drug coverage for all people in Canada, regardless of their gender, race, geography, age, or ability to pay. Through a universal pharmacare program, people in Canada should not have to be responsible for expensive copayments, deductibles, and pharmacy dispensing fees for contraceptives and diabetes medications. The reality is that people with diabetes are 3 times more likely to die from heart disease, and it affects the most vulnerable members of our society. This is one reason why this legislation is a terrific first step. We also believe that it's critical that in the near future that the formulary be expanded to cover heart disease and stroke drugs. To conclude, too many people in Canada are currently making life-threatening trade-offs and tough choices to be able to afford their life-saving medications. This bill is a step towards addressing that problem. We strongly encourage the Senate of Canada to quickly pass Bill C-64. The faster this is done, the faster bilateral agreements can be set up with provincial governments, and the faster people in Canada can actually get access to the first phase of universal prescription drug coverage. Thank you.
Good morning. My name is Jason Maclean. I'm the chairperson of the Canadian Health Coalition and Secretary-Treasurer of the National Union of Public and General Employees, representing over 150,000 healthcare workers across Canada. Founded in 1979, the Canadian Health Coalition's members work to defend and improve public health care system. We are comprised of citizens, frontline healthcare workers, unions, community groups, students, and public health experts. In February, the federal government introduced legislation to deliver the first phase of the national pharmacare to provide universal coverage for most contraceptives and many diabetes medications, in partnership with the provinces and territories. This is BC C-64, the Pharmacare Act, which passed third reading on June 3rd. In the days following the introduction of the Pharmacare Act, the Canadian Healthcare Coalition issued a statement to welcome the introduction of BC 64. The statement has been endorsed by a broad section of civil society organizations and healthcare providers from every part of the country, including the Heart and Stroke, Canadian Doctors for Medicare, Action Canada for Sexual Health and Rights, and many unions representing healthcare providers, nurses, organizations advocating for disabled retirees, women, and immigrants. Bill C-64 is a landmark legislation that takes important first step in continuing the program towards universal national pharmacare program. Canada is the only country that has universal health care that does not include universal coverage for prescription drugs outside of hospitals. Pharmacare is needed urgently to improve the health of those living in Canada. 1 in 5 people reported by Statistics Canada say they do not have access to prescription drug coverage. Low-wage workers, immigrants, and racialized people are hit the hardest. In addition, the overall cost of drugs to the healthcare system must be reduced, according to the Parliamentary Budget Officer. Prices of prescription drugs in Canada are roughly 25% above the median of the Organization of Economic Cooperation and Development, the OECD countries. A single-payer pharmacare system with the power of bulk purchasing is the best route to negotiate lower prices from drug manufacturers. Health Coalition members endorse heartily the recommendation of the 2019 National Advisory Council on the implementation of a national pharmacare led by Dr. Eric Hoskins. That was a nationwide program to achieve public coverage for contraception and diabetes medicine and related equipment delivered by a single-payer approach through provincial healthcare systems is a historic step in the right direction recommended by the Hoskins report on pharmacare. But there are many more steps ahead to achieve universal coverage of the national formulary of medicines. We urge the Senate to pass the Pharmacare Act before summer break, ensuring legislation adheres to a single-payer, universal publicly delivery in partnership with the provinces and territories, along with adequate funding and accountability measures in accordance with the principles of the Canadian Healthcare Act. Millions of Canadians can't wait for pharmacare. We're asking the Senate to come together and get the job done. Thank you.
We are happy to take any questions if there are any.
Thank you.
Thank you.